What if I told you that the itching means that itching that keeps you awake at night, that persistent itching you think is just due to dry skin or age, could actually be a signal of a deeper and more serious problem inside your body? It sounds frightening, yes, but we really need to pay attention to this. I'm Dr. Lalina Cavales, and I've dedicated my life to caring for the health of our elderly. Today, I want to give a warning that I wish more people knew about earlier. There's a silent danger that's often overlooked, a distress signal that your own body is sending, a simple itch. When it repeatedly appears in three particular areas of the body, it could be the first warning of a serious disease that's slowly progressing without you realizing it. Today, I'll reveal the three places on the body where intense itching is a clear red flag that you should never ignore, especially if you're over 50 or 60 years old. Listen carefully, because understanding this at the right time could be the difference between a long, healthy life and a diagnosis that comes too late. In my many years as a doctor, I've seen so many stories that could have had different endings. Patients who came to my clinic whose kidney damage was almost irreversible, or who had liver problems so advanced that very few treatment options remained. And when we examined their medical history, we often found one common symptom they had ignored for many months, sometimes even years, an itch that wouldn't go away no matter what they did. Most of us think itching comes only from external causes, insect bites, allergies to new lotion, or reactions to fabric. And in many cases, it is that simple. But it's important to understand that the skin is like a mirror of what's happening inside our body. It's a large organ that can show the condition of our deeper systems. When organs responsible for cleaning our body, like the liver and kidneys, start having problems, they don't always give clear pain signals. Sometimes, instead of severe pain, they send subtle but persistent signals. And one of the most common is an itch that seems to have no clear cause on the skin surface. It's like the check engine light on your body's dashboard. And today, I'll help you learn to read these signals. Let me share a real scenario I've seen many times. A man, let's call him Mr. Jose, 60 years old, started experiencing intense itching on his legs every night. He couldn't sleep. He scratched himself until he bled. His family said, "Dad, that's normal at your age. Your skin is dry. Just apply some cream." And Mr. Jose followed the advice. He tried one cream, then another, and another. He spent money on various lotions and remedies that had no effect. The itch was still there, annoying, relentless. What Mr. Jose and his family didn't know was that the itch had nothing to do with dry skin. It was actually a silent cry for help from his kidneys that were slowly failing. They were no longer properly filtering toxins from his blood. Because of this, waste products accumulated and minerals like calcium and phosphorus became imbalanced, irritating nerve endings from within until felt on the skin. His body wasn't asking for thicker cream, it was asking for treatment that could save his life. When he finally saw a doctor because of other symptoms like body swelling and severe fatigue, the damage was already severe. And this story doesn't just happen with kidney disease, it's repeatedly seen in liver diseases and even some types of cancer. The problem is, we're used to treating surface symptoms instead of asking why it's happening. And when we're talking about persistent itching in an elderly person, ignoring the root of the problem carries very high risk. Early diagnosis is crucial, and this itching could be your first and best opportunity to act. Now we come to the most important part. Not all itching is an emergency, but when it's intense and continuously felt in three particular body areas, you need to give it the highest attention. The first area that often gives warning may surprise you. It's the palms of your hands and the soles of your feet. If you're experiencing intense itching, deep as if coming from inside, and it gets worse at night, this is a big red flag. This isn't ordinary itching that feels better when you scratch. No matter how much you scratch, it doesn't go away because there's no actual problem on the skin surface. You look at your hands and feet. No rashes, no bumps, no redness, no excessive dryness, but the feeling is unbearable. This type of itching, known in medicine as cholestatic pruritus, is a very important clinical clue that may point to a liver problem. What's happening here? The liver is like your body's treatment plant. It produces bile that helps with digestion and waste product removal. When the liver is diseased or its ducts are blocked, the normal flow of bile is delayed. substances that should have been expelled, like bile salts, accumulate in the blood. And although the exact mechanism is complicated, we know that the accumulation of these compounds causes irritation to the nerve endings of the skin, resulting in the intense itching you feel. For reasons still being studied by medicine, this type of irritation is often more intensely felt in the palms of the hands and soles of the feet. To make this clearer, let me give you a concrete example. I had a patient, let's call her Mrs. Rosa, 60 years old, from Quezon City. She came to me after almost 3 months of not sleeping well. She told me, "Doc, my palms and soles feel like they have electricity, like they're burning, especially at night." I examined her hands and feet carefully. I didn't see anything. The skin was clean, no wounds, no rashes, no redness. But according to her, she wanted to scrape her palms on cement just to make the itching stop. Because of this, I requested liver function tests. That's when we discovered her bilirubin levels were already high and her liver enzymes were abnormal. In subsequent tests, it turned out she had primary biliary cholangitis, a condition where the small bile ducts inside the liver gradually become inflamed and destroyed. If we hadn't diagnosed this early, there was a high probability her liver damage would have become irreversible. But because we caught the problem early, we immediately started the right treatment, and now her condition is controlled and the intense itching she endured for so long gradually disappeared. This is the lesson here. Itching in the palms and soles isn't always just a simple skin problem. It can be a signal of serious liver disease that requires immediate medical attention. Ignoring such signals can delay the diagnosis of underlying liver disease until it reaches advanced stages like cirrhosis or liver failure. So, if you're experiencing unexplained itching in your hands and feet, don't immediately rush to buy cream. It's more important to schedule an appointment with your doctor and request blood tests to check if your liver is still functioning properly. If this information is helping you and opening your awareness, I'm asking for a small favor that would be a huge help in reaching more people with this health message. Just for a moment, press the like button on this video and subscribe. This way, you won't miss other important warnings that could protect your health and your family's health. Let's continue. The second area is the back, chest, and legs. This is called generalized itching. This type of itching isn't limited to one particular body part, but its appearance and feeling are hard to mistake. It's the kind of itching that comes and goes and sometimes attacks almost the entire body. Nevertheless, it's more often intensely felt on the back, chest, and legs. It's an annoying, repetitive itching with almost no relief. This type of itching can be a warning of chronic kidney disease, like what happened in Mr. Jose's case that I mentioned earlier. In medicine, this is known as uremic pruritus. When the kidneys that serve as our body's main filter start to fail, urea and other waste products that should have been expelled through urine accumulate in the blood. As I mentioned, the accumulation of this waste and the imbalance of minerals in the body is one of the main causes of the systemic itching. This is an internal problem, not a simple skin issue. In rare but very advanced cases, you can even see a white powder-like substance on the skin surface called uremic frost, composed of crystals formed from waste products coming out through the skin. The most dangerous thing about chronic kidney disease is it's often called the silent killer. You can lose a large portion of kidney function without clear symptoms until suddenly signals appear like intense itching, extreme fatigue, body swelling, or muscle cramps. At that point, the damage may already be severe. I want to explain why kidneys are so important and why it's so dangerous when they start to fail. Your kidneys are like the blood's washing machine every day. Almost all the blood in your body passes through them to be cleaned. They filter toxins, excess water, and waste products and expel them in the form of urine. But their function doesn't end there. The kidneys also help regulate blood pressure, produce hormones needed for red blood cell production, and balance important minerals in the body like potassium, sodium, and calcium. So, when the kidneys fail, toxins aren't the only problem. The entire body system is affected. And the scary part is you can lose up to 80% of kidney function before you feel major symptoms. This is why it's called the silent killer. Many people are deeply shocked when they learn they're already at stage 4 or stage 5 of kidney disease and the only remaining option is dialysis or kidney transplant. But the truth is, there are warnings before reaching this point, and persistent or repetitive itching is one of the earliest signals. I had another patient, Mr. Berto. 68 years old from Davao. He had diabetes and high blood pressure, minus two main risk factors for kidney disease. He thought he had everything under control because he regularly took his medication. But one day, itching started on his back, chest, arms, and legs. He thought it was just a simple allergy, but no matter what antihistamine he took, it had no effect. When he came to see me, that's when we discovered his creatinine level was already high, and his estimated glomerular filtration rate, the measure of how well the kidneys clean, had dropped to 25%. This means 75% of his kidney function was gone. If he had waited a few more months, there was a high probability he would need dialysis. But because we caught it early, we immediately adjusted his medications, implemented a strict diet, and put him under close monitoring. Now his condition is stable and the progression of his disease has slowed down. His itching is also now controlled. So I'm asking you, if you have diabetes, high blood pressure, or a family history of kidney disease and you're experiencing persistent itching that's not normal, don't ignore it. If you have itching all over your body that won't go away no matter what you do, especially if accompanied by high blood pressure, diabetes, or relatives with kidney problems, take this seriously and see a doctor immediately. It's very important to consult a doctor right away. A simple blood test and urine test can detect kidney problems at the right time. Don't wait until you reach the point where you need dialysis before you act. The earlier, the better. The third area is a particular zone on the body with a mole, spot, or lesion that won't heal. This is the most dangerous of all because it's usually small and localized. What I'm referring to here is persistent itching in just one area of the body. It could be a mole that suddenly started itching, a small rough spot that won't go away, or a tiny wound that seems unwilling to heal and is always itchy. Many dismiss this, thinking maybe something just poked them, an insect bite, or just simple rash. But localized itching like this can be one of the earliest signals of skin cancer like basal cell carcinoma or even more dangerous melanoma. Why does it itch? As cancer cells grow uncontrollably, they can release substances that irritate the nerve fibers in the surrounding skin. In some cases, the itching is felt even before changes in the lesion's appearance become obvious. Many know the ABCDE rule: asymmetry, irregular borders, varied color, large diameter, and evolution or change as a guide for identifying melanoma, but I want to add another important letter, I, for pruritus or itching. I want to discuss this in more detail because skin cancer is a condition that so many Filipinos still aren't very aware of. The Philippines is a tropical country with intense sunlight and many people are directly exposed to it daily. Farmers, construction workers, fishermen, tricycle drivers, and everyone who works outside, even people who don't work outside but walk to the market, wait for jeeps, or commute daily are still exposed. UV radiation from the sun is the number one risk factor for skin cancer. And what's more frightening is even people with darker skin, like most of us, aren't immune to skin cancer. There's a false belief that dark skin is protected, but this isn't true. It happens less frequently but is still possible and sometimes even more dangerous because it's detected late since we think we're safe. Melanoma, the most dangerous type of skin cancer, can appear anywhere on the body, even in areas not always exposed to the sun like the soles of the feet or between the toes. I knew a patient, Grandma Nenya, 70 years old from Batangas. She had a small black mole on her arm that she'd had for a long time. One day it started itching. She didn't pay attention because she thought it was just sweat or dust. After 2 months, she noticed the mole was growing and changing color, some parts brown, some black, and some reddish, and the itching still wouldn't go away. When she had it examined by a dermatologist, a biopsy was performed and it was confirmed to be melanoma. Fortunately, it was caught early, so it was removed through surgery and hadn't spread to other parts of the body. If she had waited a few more months, it might have spread to the lymph nodes or internal organs, and that could have been life-threatening. So the lesson here is clear. Even if the mole is small, even if it looks problem-free, if it's continuously itching, don't ignore it. And although not very common, generalized itching without a clear cause can also be the body's reaction to internal cancers like lymphoma. The rule here is simple. Any new skin lesion that itches, bleeds, changes shape or color, or doesn't heal within a few weeks should be examined by a dermatologist. And if your existing mole suddenly starts itching without a clear reason, That's enough signal to make a doctor's appointment immediately. Don't postpone it. I also want to emphasize that skin cancer is highly treatable when detected early. The survival rate for early stage melanoma is very high, but when it's advanced, the chances of survival drop significantly. So the real key is prevention and early detection. I know everything we've discussed may be worrying. It's natural that now you're thinking about every little itch you felt recently, maybe even mentally examining your skin. I understand that, and it's a normal human reaction. Hearing words like cancer, kidney failure, or liver failure is truly frightening. But before you panic, I want you to take a deep breath. The key isn't to live in fear, but to live with sufficient knowledge. At this point, I'm giving you tools to distinguish simple annoyance from a true alarm signal from your body.